I guess one other thing that I wanted to segue into is I contacted you because, shout out to Dr. Chris Capelli. He's doing a lot of great work with hawking grips and fascial treatments and things such as that. But I mentioned to him, I said, I'm still getting some elbow pain. Should I have a shot? And he says, yeah, a cortisone shot would be helpful. And then I said, well, what about this PRP? Dr. Sillip is doing this PRP. Should I talk to him about that? And so I messaged you. And do you want to tell the folks that are dealing with joint pain a little bit about the PRP and what the process is that we would go through?
PRP stands for Platelet Rich Plasma, and it's a substance that we make from your blood. The procedure is we draw your blood, we spin it in a centrifuge, and the red cells come to the bottom of the tube, and there's a cloudy yellow layer on top. We draw off the cloudy yellow layer, and that's what's injected. Now, depending on the area of the body, for instance, the knee or somewhere that can take a large amount of fluid, we would inject the entire amount in. You mentioned elbow. In the elbow, you need a little less, so we would take that yellow layer, we would spin it again to concentrate the platelets so that all the platelets we need are in just 1 or 2 cc's of fluid. And then we use ultrasound to evaluate the tendons and the ligaments and determine where the injury is. The shoulder, actually ultrasound is more sensitive for shoulder injuries than MRI because MRI is static, you're holding still. And with the ultrasound, we move the tendons and the muscles, and we can actually see tears in them open up and close up, and then you can tell what's really necessary and what the target is to inject. Mm-hmm. And once you've determined the target, then we prepare the area sterilely, numb the skin, numb down into that area, let the lidocaine dissipate, but then you're still numb, and then we inject the PRP. You go back to normal activity the next day. My instructions to you would be don't exercise the rest of the day. Tomorrow you can do normal stuff. You don't have to be immobilized or anything like that. Generally, my experience is elbows and shoulders require 1 or 2 injections. Arthritic knees, we plan on 3, spaced about 6 weeks apart. But everybody's different, and the goal is to get rid of the discomfort. If we do 1 injection, the discomfort's better, you're good until you're not. And when you injure it again, if that happens, then you come back.
And by injecting this platelet-rich plasma into the joint, it's obviously stimulating a healing, recovery, or...
The platelets contain growth factor, cytokines, things like that. In your bloodstream, the platelets are designed to help clot. Mm-hmm. We're not looking for them to clot. We're looking for them to break open and release the healing chemicals that they have inside.
And are there any dangers or side effects?
Well, anytime you introduce a needle, you can be concerned about infection. But by being very careful and very sterile with the whole process, we don't see problems.
This was something we actually spoke about the first time I came here, and you actually quantified this as being least expensive and most effective when it comes to dealing with a lot of joint issues.
In my personal experience over the years, I've done cortisone injections, I've done the Hyalgan or hyaluronic acid injections to the knees, and I've done PRP, and thousands of each. And in my opinion, the PRP works the best.
That's awesome. Well, I'll be doing an ultrasound first to see if I have a need for PRP, but if I do, you can watch the PRP journey on top of the weight loss journey. So there it is. Thank you. Thank you very much.